with us today, so he's delegated his tasks, like all of them, to Fiona. So she will be recording and taking a minute and doing all sorts of things. So, and speaking to reports. So in Finley's absence, the recording has now started. So good afternoon and a very warm welcome to this, the Community Planning Partnership Board of the 18th of September. Some of us are in room 2 in Wood Hill House and others are joining us online. Now we've got quite a list of apologies. So they have been recorded. I don't know if you want to go through them, Fiona, or are you happy that they're just being recorded? Happy that they've just been recorded. So some colleagues are on leave and others were not able to join us. And it's nice to see Superintendent Smith. I think we've got your apologies, Graham, so it's very nice to have you with us. So just before we do start, this will be Superintendent Smith's last community planning partnership meeting as you are retiring, I believe. So I'd just like to take this opportunity to extend our thanks for all that you've done and your contribution within the executive. And clearly your attendance here today is very welcome. So thank you very much indeed for everything that you've done to promote community planning and indeed to extend the reach of the partnership. So thank you, Graham, and wish you every success and very long and happy retirement.
Thank you very much. 4 working days left, not that I'm counting at all.
No, I could see you're disappointed. So thank you very much indeed for that. And I think we've got, yes, we do. We have Anne Aiken and Lisa Buchan on the call with us today, our colleagues from Scottish Government and Community Planning Directorate. So Lisa, you're joining us as an observer today, but Lisa is the team leader for skills, talent, attraction and retention. And you're most welcome, and I hope you enjoy the meeting. And again, thank you for joining us, Anne, also. So thank you for that. Okay, so item 2 on our agenda is declaration of members' interest. So can I ask any members if you have interest to declare or transparency statements to make, please? No indications. So on that basis, then we'll move on. There's public sector equality duty, and that is printed on your pack on page 2. We're being asked in taking decisions on the undernoted items of business on your agenda. We agreed to have due regard to the need to eliminate discrimination, harassment and victimisation, advance equality of opportunity between those who share a protected characteristic and persons who do not share it, and foster good relations between those who share a protected characteristic and persons who do not share it. And where an integrated impact assessment is provided, to consider its contents and take those into account when reaching a decision. If you don't agree with that duty, please raise your hand and I'll bring you in. So that is agreed. Thank you very much. Item 4 on your agenda is the minute of the Community Planning Partnership Board on the 5th of June. And can I ask, please, if that was a correct note of the meeting? For those of you who were in attendance, you put your hand up and I'll take you in if you have any comments. No, so that is approved and is recorded as a correct minute. Item 4.1 then is the action sheet arising from that minute and ongoing actions. And maybe, Fiona, if you could just take us through that, please. And we'll take any questions or comments that you have as we go through.
Yes, thank you, Chair. So the first item on there is around the transition to delivering a place-based approach from connected and cohesive communities. So I think that's probably a bit wider now than than simply connected inclusive communities, and there's a report on the agenda today providing feedback from a CPP exec workshop that was held last month around delivering a place-based approach. The mental health and wellbeing LOIP review and evaluation, I think that Eva are going to be stepping back from that LOIP, and again that is within the place-based report that I'm going to be delivering later on around that. In terms of the health and transport action plan and sharing resource, Amanda, would you be able to provide any update on that action?
Apologies, I thought I had updated on all of my ones, so apologies. Which action?
The health and transport action and the sharing resource.
Yes, I have. There is an update in the report, but we have met with the chair of the HTAP group, and as noted, we're designing a financial pathway to support in relation to the recommendations that were flagged as part of that report.
Thanks, Amanda. The next one is around rural transport. That's with Amanda and Susan.
Yeah, I mean, I'll look at to Amanda, but I think the action above actually covers the next two actions, because I think it was quite a comprehensive and helpful conversation that Amanda and Lindsay had as chair of HTAP.
Thanks, Susan.
It was. I can clarify and confirm what Susan has said. It was a good discussion, and recommendations are being taken forward.
Can I just ask then? There are 3 transport related issues on the action plan, and one of the pieces of narrative certainly looks at ensuring that there's no duplication to include policy and strategic direction. Again, we've got nest strands, we've got the health and social care element with Lynn Boyd leading it. We've got Lindsay's work on HTAP. We've got tackling poverty and inequalities. I really think it would be helpful, bearing in mind the budgetary implications of some of this, if all of this could be brought together, and if those involved in those strands could have a discussion and perhaps look to give us a little action plan specifically around all of that. Because if everyone's doing work around the transport element, I sat on behalf of Health and Social Care in a public transport unit member officer working group last week. So again, there's all sorts of different strands here, and I really think we should be pulling them in as far as we possibly can, so that any budget implications are captured and budgets are aligned and are working in parallel, so we're not all trying to do different things in different places at different times. Now, apologies if you're all doing that, but I do think we need to be really careful here, because I was asking the question last week at that member officer working group, how tied in the work that the public transport unit are doing with the health piece, for example. So I'm sure they are, but I just think as a partnership, we really need to get to grips with how all that fits. And then the next thing is place. So Rob, can I ask you to take that off table with colleagues, please, and have a look at that?
Yes, absolutely. And I was just we've also got transport transformation theme as well, which ties into this and ties very much into that place piece across our communities. So that mapping and then action planning off the back of that would be hugely helpful from that perspective also. So happy to take that away as the action, which will encompass the actions that are sitting on the action plan at the moment also.
Thank you. Yeah, I've got just taking a wee note there, John. Thank you, Rab.
Thank you, Chair. Just to say that obviously we have very close working relationships with your local officers, both the local transport strategy and the public transport team. We also work through the Health and Transport Action Plan and have close links with the public health sector. I think Lindsay is sitting in on the
Yes.
on the call today, who's the new chair of the Health Transport Action Plan. But absolutely, if there's an opportunity for us to improve or foster these relationships, if this group wants to make a recommendation that we ensure that that relationship is as tight as it can be, I think we would all be delighted with that. It would be easy for us to say we already do it, but I think there would be no harm in us going away and just checking, can we be more effective and make sure there's no duplication. A lot of the same people are involved in the groups, but that can be a strength rather than a duplication.
I think that's very helpful, Rob. And as I say, I think there's lots of different strands of this that could do with getting pulled in. Because again, we have to manage expectation out in the public domain as well. Because we cannot deliver everything that everybody would like. And I think that's another thing we need to bear in mind, that we need to, because we're all, as it goes, fishing in the same financial pond, and there's not enough fish around for everybody to actually take home and eat. So I do think that we need to be mindful of all of that and work towards, and then there's key messages to go out from that. So we've raised expectations in some ways. We need to manage how we deal with that. So are members content to actually agree that recommendation? I've got nods in the room. Everybody online happy? Yes, that would be great. Thank you. So Rob's taken a note of that, and that'll be worked through. Thank you. Sorry, Fiona.
Thanks, Chair. And the next outstanding action is the place examples, and that was an action for Anne Bacon to see if there were any examples that could be shared of a place-based approach from your connections. And I don't know if you've got any updates on that.
My apologies, Fiona, it slipped off my radar. I'll pick that up and come back to the next meeting.
That's fine, no problem. Thank you. And there are quite a number of actions that have been completed since the last meeting. I don't know if you want me to go through each of these. No, just happy with those on the agenda. Thanks, Chair.
That's fine. Thank you very much, Fiona. As Fiona said, on pages or two of that report, page 6, 7 and 8, you've got the completed actions. So we probably need to progress the mental health and wellbeing LOIP review and evaluation as well. So Dan's on the call today, so with George's apologies. So if we can just make sure that that's progressed as well, that would be grand. Any questions? No, so that's fine. That is noted. Thank you very much. That then takes us to item 5, which is reducing poverty LOIP, and the update report is attached. And as always, Amanda, I would just ask you to give us an overview. We have the report before us, and if you have any asks of us, then we'll be happy to hear them. Thank you, Amanda.
Thank you, Chair. Probably draw your attention to a couple of things in the report. We have just covered that there was a discussion on the Rural Transport Review paper at the last meeting, and following that discussion, there was the discussion with the chair of the HTAP group, and recommendations are being taken forward out of that. And one of those key recommendations is a financial pathway being designed to support the transport costs for those families who are experiencing financial insecurity, and they have got children and young people who have got significant health conditions. That was an issue that was also brought up at all the area committee discussions. So really pleased to see that is progressing. The partnership met a couple of weeks ago, and we focused on childcare and childcare funding. This was following on from some research that we'd received, which indicated Aberdeenshire has one of the highest costs of childcare. The board will be aware that we are working towards the delivery of a strategic childcare framework, building on some recent research that we had undertaken. We've got 2 actions that we have progressed. One of those is a referral pathway, which means anyone who is interested in taking up a career in childcare has a kind of warm handover approach where they get that right support from the moment they are with us. And that's covering things like the training, the advice, how to be self-employed, information from the Care Commission. But we've also recognised the funding gap around new setups. It can be difficult for new setups to cover their staffing costs or running costs while they build up their client base. So we have also developed a fund which is available to hopefully 20 new settings will be created as a result of the fund, and that will provide grant funding to cover their costs in the first few months. The other item I'd like to draw your attention to is it is Challenge Poverty Week in October. There are a number of events happening, and so the board would be most welcome. And just leading into Child Poverty Week, there is a youth-led event, and again the board is asked to consider dropping by that event. It is an event that has been developed by the Youth Poverty Group that's led by young people from across Aberdeenshire. They meet regularly to discuss poverty from their perspective, to look at the issues and challenges, and as a result of that, they have organised an event that they wish to see as a bit of a springboard for change. So it's a chance for them to have their voices heard. So there is an open invitation to all board members to drop into that event, which is at Inverurie Community Campus on the 28th of September. And I would also seek comments from the board on some of the place-based interventions that I've summarised in the report. That's recognising the board's endorsement of the place policy and strategy and that move towards place. So there are a number of the local areas highlighted in the report and the work that they are currently doing to reduce poverty in their areas. Thank you, Chair.
Thank you very much, Amanda, and I think it's really welcome that you're highlighting the event, Over to Youth event in Inverurie. So I would absolutely encourage all partners around the table to try and be represented at that event. It really will be, you'll get the opportunity to speak to a DJ group, and you'll have all sorts of entertainment on the day. But I think it's really important that we as a board and a partnership actually support the young people who've worked really hard to get this event off the ground. And in terms of Challenge Poverty Week, Amanda, I wonder if we could approach the representatives of the partnership and ask them, you'll all have seen these frames that people pose in, and recognise that there is an issue. And Challenge Poverty Week, we've done this in the past. But I do think we need to try and encourage our partners, all partners around this table, to do something to recognise that particular week. And if we can do that with your support and help, Amanda, and guidance, that would be really helpful. I do think we need to step up really and start to be a bit more visible when these things come along. So I'm sure, certainly the council, I speak on behalf of the council, we'd be happy to do something to recognise the week. So we will do that. Any questions for Amanda, please? In fact, she's looking for responses in terms of place-based intervention. So any comments, queries, observations? Councillor Gillian, please.
Thank you. I was just really going to ask, under where it says Inverurie Community Campus, I'm obviously going to try and go to that myself. But my key will be whether I'm allowed to drive or not. But it is my plan to go. I was just wondering, the Friday the 11th of October, the Employability and Financial Inclusion Conference that's here, would it be wanted if I dropped in for a half an hour or something, or is it not appropriate? Or if I'm going to pop in, do I need to be there for the whole time?
Through you, Chair, I think if there are various workshops as part of that, there's an opening panel and a closing panel, and I think if you were able to pop in, that would be most welcome. Chair of this board and also as Chair of Communities, Councillor Stirling will be, I think, at the event and part of some of the opening panel.
Yeah.
So partners, again, if you are around in Woodhill House or able to be in Woodhill House, you would be most welcome as well.
Okay, thank you.
Thank you.
Dr. Thompson, John, thank you.
Yeah, it's very positive seeing all the work going on and seeing it broken down into the different areas. So there's that activity and the outputs from it. Are we able to break down the Aberdeenshire total figures into those kind of areas, so that over time we can get some kind of, I know it's difficult to attribute exactly, you know, action and what its impact is, but just so that we can look at this from both ends of this.
Please just come back, Amanda. Just
Okay,
carry on.
again through you, Chair. Yes, absolutely, Dr. Tomlinson. We can do that. We can break the data down by area and also by wards, and I think we also have it by parliamentary constituencies. So at that local level, and certainly within our community plans and also our intermediate data zone data packs, we have that information there, so more than happy to ensure that's provided to you all. The one challenge we have is trying to demonstrate the what if we didn't do what we're doing, what we find. We know our child poverty numbers are not getting better, which is incredibly challenging and disappointing, because a lot of really positive work is going into to try and lift families away from poverty or stop them going into poverty. But we know at the moment, with that cost of living crisis and other things that are happening, that is why some of the work doesn't appear to be having the impact that we would have hoped it should have. So we are working with our public health colleagues to try and work out a way to model, so that we can see what the impact would be if we didn't do certain things, and what the impact should be if we do certain things. So that's a work in progress, but certainly more than happy to share the data that we have.
And I think that's really helpful, and I think we do have to acknowledge that it is difficult to attribute through that, but unless you start to break into it, you're blind to that. So no, that's really welcome. Thanks.
Thank you, Amanda. Again, if there's data that you have from the information and advice services, because again, they are working really hard to support individuals and families to increase their income, and they've been very successful at that. So again, it's just another outlet for them to be able to demonstrate their outcomes and successes. So that'll be fine. Thank you, Susan. Thank you.
Yeah, no, thanks very much. A couple of queries and a question for me. It's absolutely, childcare is critical. I was doing some work with employers around living wage, and they were talking around how they had changed their policies to be more family friendly, and I just wondered, is that captured maybe in a different component around employability, or is that something this group has looked at? So some examples where employers were starting their shifts later on so that families were able to eat together, supporting attachment within families, which we know is good for the children. My second question was quite a lot of reference to fuel poverty, but also aware that there's a significant number of properties in Aberdeenshire and private water supplies, and I guess one might assume that if household incomes were reducing, that we might see a reduction in looking after those private water supplies, which could lead to increasing infections. So again, just wondered if there was any asking around that. And then my final question was, really like the Poverty Alliance report and the work in Aberdeenshire, really helpful picture to see. I just wondered if they suggested any learning from elsewhere. You know, great that they were endorsing everything that's going on, but was there any learning that they were able to share with the team?
Thank you for those. I think that is a really interesting question around that employability piece, and what are employers doing, perhaps not just around are they paying the real living wage, but what other actions are they demonstrating that help with families. So I'm more than happy to take that away and see what I can find out. The water supply, the private water supply, I have to say that has never occurred to me before. But I understand it from the way you've spoken about it. So again, I will take that away and add that in. And in terms of the Poverty Alliance work, that's them really just at their early scoping stage. We're expecting further work to come from them, which would include that learning piece.
Okay, Susan, can I just ask officers on my left here, we don't have anybody from environmental health on the call, but I believe that there is a duty to test all supplies. We've got one of the highest private water supplies in Scotland, in Aberdeenshire. So, but Rob, can you shed any light?
Beyond that testing schedule that is undertaken, I don't have a huge amount of knowledge around the area, but it is undertaken on a regular basis.
Yeah, we've got a duty to do that. But Amanda, you can maybe get some information back, but
yeah, it's covered in our joint health
Yeah.
protection plan. I guess the issue is we're talking about poverty impacting on rural households, and I think private water supply, and we know from some of the outbreaks that we've had that has been due to family income. But however, it might not be a big issue, but I was just curious.
I suppose with the flooding, increases in flooding and things as well.
And drought.
And drought. So we're going to extremes where we've perhaps not been in recent years. So yeah, so maybe between Rob and Amanda, they can pick that up. Susan, thank you. Any other questions or observations or responses for Amanda? Nicola, thank you.
Thank you. It was just to come in a little bit on the employer piece, and I know Amanda will go and do a wee bit more around this, but just from my own understanding, with employer colleagues in SDS, we'll speak very closely with colleagues in Aberdeenshire Council, with Scottish Enterprise, DWP, and do a lot of kind of internal referrals between them, so to support employers. And I've certainly heard, really good examples of employers changing practices. I think some employers are maybe struggling to recruit, so they're looking more at their practices in terms of hours, shift patterns, and linking in with transport to support that. But how we kind of collect those numbers and get that evidence, aside from anecdotal, I'm not quite sure, but it was just to add that bit in there.
Thank you, Nicola. And maybe if you could Amanda may well liaise with you and get that kind of big picture there as well. Anne Aiken has popped in the chat there, and I think absolutely that certainly those with private water supplies often are the first to be hit by the water scarcity issues. Absolutely, absolutely. And also when you have power cuts because they need pumps to pump water into their properties. And certainly during Arwen, that was an issue in my area. So, because if you don't have the electricity, you don't have the water, you don't have a supply. So lots of different aspects of all of that. Okay, thank you very much. Amanda, I don't see any other indications. Are you content you've got enough to be going on with? Maybe you got a bit more than you anticipated to come back, but I think it's really, really valuable to have these discussions and to have these things discussed. So thank you very much indeed for that.
Thank you.
And please take our thanks back to you, Annette and team, who are continuing to drive this agenda in very positive ways. So thank you. The recommendations then are on page 10. And we've been asked to acknowledge the achievements identified in relation to the delivery of the priority, note the current work of the Tackling Poverty and Inequality Strategic Partnership, and consider the invitation from young people to attend the Over to Youth event on the 28th of September in Inverurie, and also to comment on the place-based interventions. But also, if we can perhaps record that there's an invitation for partners to promote and to acknowledge Challenge Poverty Week as well. That would be really good. Thank you. So can we agree that, please? I'll take silence as an agreement. Okay, thank you very much. Item 6 on our agenda then is the Community Planning Partnership Draft Annual Report. And I can't believe it's this time again. But the recommendations on page 66, we've been asked to consider, comment on and approve the Community Planning Partnership Draft Annual Report. And then it will be published when it's approved on the website. And note the draft annual report that's been considered by Aberdeenshire Council's Communities Committee on the 5th of September. And can I ask Fiona, please, to introduce the report? Thank you.
Thank you, Chair. Good afternoon again, everyone. I'm pleased to present to Board today the draft Aberdeenshire Community Planning Partnership Annual Report for 2023-24. The landscape for delivering community planning continues to be challenging, with all partners experiencing significant budgetary challenges alongside an increasing demand for services impacted by factors including cost of living and demographic changes. Despite these challenges, the work of the Community Planning Partnership continues to benefit communities across Aberdeenshire, and the annual report highlights some of the achievements of local teams in meeting the needs of the most vulnerable in our communities. I'd like to highlight in particular the work around cash first approach carried out by the Tackling Poverty and Inequalities Strategic Group under the Reducing Poverty LOIP priority. And that initiative has supported almost 2,000 families to access additional benefits and financial support that's available to them. We're seeing an increase in the number of people living in poverty, which is being expounded by the rising cost of living, access to affordable childcare and transport, which is impacting people's ability to secure sustained and well-paid employment, as Amanda has just been speaking about. Some families, particularly in rural areas, are having to take on more part-time local employment opportunities which fit around caring responsibilities. The Worried About Money leaflet has been revamped to include information around support around mental health, and paper copies are available in a range of languages. We also have our Lived Experience Forum, who have highlighted that they feel valued and empowered and part of the community, which has resulted in employment and confidence to move into further education. Under health and wellbeing, a number of actions are being progressed to support our residents to maintain healthy weight, with a comprehensive review of those actions currently being undertaken by the Strategic Lead Group, and also with a focus on place planning to make sure that this becomes embedded in our way of working. Wellbeing festivals have been a real success story from the mental wellbeing strand, and again work is being undertaken to take this forward and other pieces, including Mind Your Mind, as we transition to place planning. The CPP made the decision to stop the Connected and Cohesive Communities LOIP priority during 2023-24 on the basis that the valuable work carried out under that priority would transition to place plans. Some of the highlights from the year include the work with the Council's Place Economy team, which in conjunction with local partners supported 77 local businesses from across Banff and Buchan to accept payments from the Aberdeenshire gift card scheme, encouraging people to shop locally. The report also highlights the impacts from partnership working with Police Scotland, including engaging young people at risk of becoming involved in antisocial behaviour in outdoor activities, working with pupils at Banff Academy and primary schools around online and social media safety, and regular mobile and foot patrols in Banff. In June, the CPP board endorsed the Council's place policy and strategy and is transitioning to a place-based approach to delivering community planning in Aberdeenshire, and our annual report next year will provide details on progress. As the Chair mentioned, the annual report was presented to Aberdeenshire Communities Committee on 5th of September, and helpful feedback received from members has been incorporated in the report. Thank you, Chair, and happy to take any questions.
Thank you very much indeed, Fiona. So, colleagues, over to yourselves. Are you content that the report reflects the activity for the year? Have you any comments or observations? No? No comments. So are you then, sorry,
I can't get between my screens. Yeah, no, thanks very much. It's really great report. I guess one was, and apologies if I've missed this because I was conscious it's gone through the council route. So should every partner have taken it through their route also in advance? Because I'm not aware of seeing this till today, so it's a question in case I missed something. And my second question is, could somebody explain arrows in the RAG status report to me?
Yep, sure. So through you, Chair. So the first question, I'm not aware that other partners formally take this through other governance routes before it gets approved by the board. I'm not aware that that happens, or that it's a requirement. I don't think it's happened before. I've certainly not heard of other partners taking it through governance routes before it comes to the board for approval. In terms of the RAG status and the arrows, I think, I've not got them in front of me, but I think the up means that it would be getting better and the down means that it would be getting worse.
It doesn't quite, it's because that's what I thought it was, but some of the arrows are
They're not
sort of
going in
going
the right direction.
not going in the right direction. So sometimes the data has increased, but actually the metric it reports to means that's a deterioration of precision. If you know, it might just be helpful to
review those.
go through
Yeah.
them. And there was a couple that had said they'd gone down when actually they've gone up. So there was just, I'm happy to have a conversation offline. I was just trying to work out what the arrows meant and couldn't, so apologies for that.
We'll get that sense check, Susan, before it's published. Will you get in touch with Fiona then?
Yeah, happy to
that's
take
fine.
that. I've just reading it earlier, so apologies.
Just in case you didn't hear that, we're going to sense check the trend on the part of the report that looks at the RAG status. So Susan Webb is going to liaise with Fiona and just sense check that in terms of making sure the arrows are pointing in the right direction. So it won't be published until that's done. So that's fine. Thank you. Dr. Thomas and John.
Yeah, thank you. No, it's a good read. So very much welcome the report itself. So I'm not sure if it's just now or maybe it's under the Population Health Alliance paper. It's a general question about, are we addressing that kind of holy grail of prevention adequately across our different themes? Yeah, is there a conversation to be had around that? Because I mean, I understand when you presented this, you're saying despite the challenges of everybody, but there's also something about because of the challenges, we have to find a way into that. And although that's difficult, so it's really just an open question of, are we starting to get our teeth into that, or is there something else that needs to come on? So I know that's more forward-looking than this is a report, and happy to consider that under a different heading here. So
I think I'd always push that back to the organisation sitting round the table. How are each organisation contributing to early intervention and prevention? And how does that play out in the annual report? So I think there's maybe a two-way street there, John.
Yeah.
So, you know, the Community Planning Partnership wouldn't have a strategy that says we will have early intervention and prevention as a priority. That sits within the partner organisations. So again, happy to have the conversation, and maybe Rob can take that through the executive about how that's reflected going forward. So Lindsay, you're on the executive, so and how that's reflected going forward. But each organisation will have their own strategies and their own action plans. So that's probably the executive tables where that would come together.
and if that's a way of starting to see that would be fine. I think that's my ask is that we can start to see something like that. Yeah, thank you.
But I think it also sits within tackling poverty and inequalities piece. It sits in health and social care.
And
You know, it sits across the piece. So how do we, what hook do we have to pull that in? And I suppose it might be the next couple of papers, where you'd want to feedback from, you know, the Alliance or the Population Health Committee that you chair, or, you know, so I do think it's maybe a conundrum with moving parts that would ask the executive to have a look at and and see how that would all fit.
Yeah, well, that would be good, because at some point, one agency's action can be can save money for somebody else.
Sure.
But actually putting that money in at a time of such challenge is going to be difficult. So getting some line of sight across that would be good. So thank you.
I'm not sure we'll achieve what you're asking,
Oh, not immediately, no.
but I do push back to everyone else, every other partner, that you know that's something that they're mindful of within their own strategies and their own action plans. Anyway, a conversation can be had. Okay, thank you for that. I don't see any other indications, so I'll take that then, that we agree with the recommendations, with the caveat that whilst it's been approved in principle, I think it's been approved in principle, subject to that sense check around the trends in the RAG, the red, amber, green framework, and again an action from the conversation asking the executive to look to double check that organisations who are partners here have got an eye on the early intervention prevention agendas and how that would materialise and how that would be reported in the next annual report. Okay, John, does that cover?
That's fine, thank you.
Okay, thank you. So that's agreed in principle, subject to. Okay, thank you very much. That takes us then to, oh, and really sorry, just before we leave that, in terms of Susan's question around other organisations taking this through the governance route, and within the council, the communities committee is the governance route from council back to the community planning partnership. So that's the link that we make. So in terms of, I mean, we don't own the community planning partnership. We happen to chair it. But it's not the council's. And so the council as a partner, because we are just a partner, the communities committee has the eye on issues arising within the council to feedback to community planning, should there be any feedback. So that's the governance we've got in place in the council. If that helps you or hinders you. But
I think so. And as I say, I might have missed it, but the first I saw this was for this meeting, and I guess it's a question because it's a great report to use within partner organisations to flag what community planning is doing. So it was the ask about actually we could do something similar through the Population Health Committee, but equally it's not too late following publication to take to the Population Health Committee. So it was just trying to be clear as to whether we missed something or whether we need to link more closely and orchestrate.
no, it is certainly just part of the council's governance. That's how,
Yeah.
that's the link we have as a council to the partnership.
Yeah.
So that's, but I mean, what we can do and take an action to do is when the draft paper is ready next year, that it's sent to all partners and you do with it
Yes.
what you will. Within reason, of course. So, Adam, are you content with that as vice chair?
Yeah, very much. Thank you, Anne. I think that sounds absolutely right. And I think it's a really positive report and shows lots of good stuff and more to come as well, doesn't it? So thank you.
Okay, thank you very much. That's what we'll do. We'll take that as an action. So you'll get it a few weeks beforehand and you can take it through whatever route you've deemed appropriate through Adam. Okay. Thank you very much. That moves us then to item 7, which is the North East Population Health Alliance. And again, we have a year 1 progress report before us. Susan is the responsible officer, but we have the annual report attached. And Pam, you're down as speaking to this, but obviously we've got people round the table who are involved in that as well. so they can all contribute too. But Pam, would you like to introduce the paper, please? Thank you.
Yeah, thanks very much, Chair. So, and I did say to Susan, you can come in and support the detail, hopefully. So I think this was when this came to the North East Population Health Alliance, which Jim Savage chairs. I think he was really keen that we brought the reports to this group. So as described, the North East Population Alliance is where partnerships have come together collectively to look at how we can progress areas of where maybe we need to address issues around population health, what we can learn and do together, and where in a similar way as the CPP, how our joint undertaking has a greater impact than if you're all working as individual organisations. So I think Jim was particularly keen to come from Aberdeenshire to come to this group. So we could reflect on the learning and experience of the North East Population Health Alliance in its first year, the areas where it has kind of targeted itself and started to form. And so this is its first year's annual report. So I think probably what's key and come through here is that this was very much a first year of establishing itself, developing itself as a learning system. And as articulated in Appendix 1, you can see the areas of work that were progressed. And that hopefully will then spawn and inform work that the CPP does and vice versa. As outlined, there's an area where I have been leading on, but I think there has been around substance use. There has been a number of learning events and activities taking place through the year, which have started to set out the areas of focus for the North East Population Alliance. And I think it's really to feedback to this group and maybe get thoughts going forward. But in terms of the detail of the annual report, Susan Ross could absolutely go in detail on that.
Do you want to say anything, Susan?
Yeah, thanks. And I think, as you can see from the report, different areas of work have happened in different localities, and that's absolutely where partners feel they would benefit. So I think the things that are promising are the Inequalities Atlas, which currently is sitting a bit like a data repository, but we have demonstration of that at the Alliance, and there's some incredibly helpful tools or questions that we can ask from it, such as looking at transport within a 20-minute or 40-minute neighbourhood, and where, for example, healthcare facilities are placed. So lots of great data in that, and that's been supported by the HDRC. We've got the Charter of Rights, which Pam's leading on. Place and wellbeing, again, one of the key things that has come out of that is around social prescribing and enabling learning across the North East. Taking learning from Aberdeenshire, the healthy eating, active living, that whole system approach to obesity. Bury and Aberdeen City are following in Aberdeenshire's footsteps, using the framework to review the work that is underway. So I think just some quick highlights against the objectives that were agreed by all partners in the first year.
Okay, thank you very much. Any questions for Pam and or Susan? Or any observations? Adam, please.
Thanks, Anne. Yeah, thanks, Pam and Susan. It's a comment, mine, not a question. I sit on this group as well, and as Pam said, I think it's very much found its feet. It's been finding its feet and found its feet, and I think it's absolutely the right thing to do. And I think as it continues to develop, the key bit for me is figuring out what absolutely makes a fundamental difference, doing it across the whole northeast bit rather than bits that clearly work better in each of the different patches or organisations within it. So I think it's a really positive thing, and really nailing down that bit where we get that huge added value from working together will be really key to its success, in my opinion. Thanks.
Thank you, Adam. Anyone else? I just want to ask, in terms of police and wellbeing, is that aligned to the police strategy that this partnership board has signed up to, and it's not something different? So again, just looking for some assurance around that, because police and wellbeing, you know, is police is a specific thing that every partner around this table have signed up to. So we're not doing anything different. Certainly social prescribing. I think our Live Life Aberdeenshire colleagues are keen to become involved or more involved. They do have links, but I don't think that the prescribing has been taken up. The option to prescribe on that basis has been taken up particularly. So maybe that's something we could jointly have a look at. So I mean, the cost of living piece and certainly is that linked back through to the work that Amanda and Annette are doing, and just looking for an assurance that all of this is linked up and we're not duplicating effort, because that was one of the concerns when it first came to this board, was duplication and doubling up on what community planning partnership executive were doing. So we need to be sure that that's not, it's like the transport stuff, we're not getting all lots sorts of different strands coming through. And I did speak briefly to Lindsay at an event recently in terms of making sure that our HEAL, Healthy Eating Active Living piece, it's been on the go for quite some time now, is embedded, and we start to move away from directing traffic, if you like. There'll have to be a light touch review and making sure everything is going as planned. But I do think we need to embed that and, you know, start to pull back. There are 4 subgroups that are, you know, so people's time's taken up, whereas I think they've done a great piece of work, and it should actually be running now as part of the daily work. So yeah, but thank you for the report, and those would be my kind of questions that we're not crossing over too much.
I mean, do you want me to exactly, certainly for the high cost of living that was identified within the DPH annual report, it's one of the 4 threats to population health. What was undertaken was an evidence review about what works in that area. Work was undertaken then with the 3 community planning partnerships against, here's evidence of what works, what are we doing, what can we learn from that, and then everyone came together. The feedback that we got was actually it was really helpful for City Sharon and Murray colleagues to come together, because they don't have that forum, and they were able to share practice. What we've done is pulled out things that support practitioners to undertake work in this field, but we've also identified some of the barriers, and there was a real question around, we've got some really great activity going on, people like it, but sometimes we haven't evaluated it as well as we could have, so we can't say, and it has made X difference. So that was a real ask that was then taken back into Aberdeenshire Community Planning Partnership to have a conversation about how we might get some of the capacity to support that, and conversations are ongoing at the moment with Public Health Scotland around how we might take that forward. So that's that example. In terms of the social prescribing, absolutely, the work started looking at evidence base around place-based working. Practitioners identified that social prescribing was an issue, and what the joint work across the area has done has set out some of the evidence base around social prescribing, some of the barriers that get in the way between perhaps health professionals willing to prescribe a community support, and so how we can work through that. And I think the model was presented to the Alliance, and certainly there was really positive feedback, but I'll let Pam speak, because that's an area with the.
Thank you.
Yeah, thanks so much, Chair. So I was going to come on a
couple of points. One was on place. So I think that what I have found really useful is that it's that the model, we're using the same model for analysing place. So the quadrants where you go around and you analyse a place in terms of its different dimensions, which will make a difference to being a healthy place. And so it's the same model as we used in the place-based policy and in the Fraser Shaping Places for Wellbeing. So now the fact that that is part of the North East Population Health Alliance approach means that, for example, you're able to have really good conversation with the work that the NHS board is doing on putting people first around some of the approaches that they're using, because we're all using the same language around place. I think that has been really helpful, because we're all talking about place as a concept, but are we all using the same framework? And I can confirm that we are, which I think is really helpful. So we're speaking the same language. And on the social prescribing, you're absolutely right, Chair, in terms of where have we actually implemented it. But what we're now doing is, from the evidence that was presented, is that, and I know, we're so tight for finances at the moment, we need to make out that every bit of investment makes a difference. So I think this is giving us the evidence base that as we start to work with, whether it's practices, etc., around social care prescribing, that we're doing it in a way that we know that we're, it's going to want benefit, and rather than nice to do. So I think this is where that learning, that shared learning, has been supported. So it's kind of two examples I can think of.
That's helpful. Thank you very much. Dr. Thomas and John?
Yeah, thank you. Yeah, I know this is a kind of work in progress, it's evolving. And so it's going back to that point about the governance bit of it. I think it's an officer level alliance. So I can understand that officers here and there, etc., will join the dots. I think it's that joining in the dots at the kind of board level, which I think is important. I just happened to sit on, I was making a note here, but actually 3 or 4 places where it'd be helpful to have sight and almost endorsement, and then you can let it go and it'll come back. So it's a long way of asking a simple question, but in terms of context, if the next year's themes can come to the boards, then at least we've got a line of sight in the governance bodies of what's going on and can ask any questions about the linkages, but then let it go and see it come back in the next annual report. So I think it's making that direct link to the governance bodies, which, if that's not there, it becomes a wonder what's happening. So simply, will year 2 fees just come to us so that we have a line of sight?
Yeah, absolutely. You recall that the objectives were approved through each constituent body, and I think what we were trying to do was do, just after every alliance meeting, a bit of an update about what was discussed and reviewed, so that members could share throughout their organisations to raise awareness, just to keep, because everybody is so busy, just a quick brief to keep people up to date. Our plan moving forward is twofold. We are aware that everyone is having conversations around the population health framework, so we've agreed that it'd be helpful to share what comes out of those conversations. That there are assessment again on the agenda around the community health equity work at marketplaces, and again, just if there's learning from that. And then finally, I'm having interviews with each of the members, and we've got a workshop then in November just to get a sense of what are the things that we're all working on to get individually, what are the things that we are challenged by, and then start to have a bit of a conversation about, and what are the things that would benefit from us working together on. So that's the timeline for that, and then we can bring it back, because we'll, and as you can tell, different areas have signed up to different bits of work, and that's absolutely fine based on the needs.
Okay, so like in this, it's got the following high level themes we agreed for focus in this first year. It's the equivalent of that for the next bit, if that comes back.
Yes,
Then we
yeah.
have a new 1 to 6.
Yeah.
Okay, thank you.
Okay, so if everyone's agreed, we can take that as an action from this report that the high level themes for year 2 will be reported back at the appropriate time to the board. Could you just clarify though, in terms of, you said that things are coming back into community planning, where are they going?
In terms of the high cost of living.
When you were talking about it's coming back to community planning,
So
bodies, so.
for higher cost of living, we had a workshop for community planning where we went through the feedback that we'd had, and then we'd identified some actions, one of which was around evaluation, but I'm not clear. Certainly we've continued to have conversations with Public Health Scotland to see if we can get some capacity around that, but I don't think that has actively taken forward. But it's through, we've been looking certainly for higher cost of living with Kate and Amanda.
Right. But I don't think the chair of the executive group's aware.
Well, now that we've got Lindsay on, I think once the executive group starts meeting regularly, then we've got the opportunity to connect in, so happy to do that. Okay. Okay, thank you, Adam. Okay, but can maybe you can follow that up, Rob, with Kate?
Yeah.
It's fine. Okay, it's fine. Thank you very much. I don't see any other indications. Are we content then, I think, to acknowledge this report? And there'll be an action to come back at the appropriate time to report back on the high level themes that are being considered for year 2. Agreed? Agreed, thank you very much. And thanks to everyone for the report. Item 8 then is population health framework, which is really just a seamless move into the next report. The recommendations on page 135 to consider and comment on the framework, the areas of action proposed, and the engagement questions with consideration of the opportunities and implications. Ask the executive group to consider the partners' responses to the framework and submit a response to the engagement process, and receive the final population health plan and consider implications for future areas of improvement. So again, I think we've got Susan.
Yes,
thank you.
Yeah, thanks very much, and thanks for the opportunity to put this on the agenda. I thought time was quite tight, so I'll just do a brief introduction. There is a slide setting it out. Clearly, the population health framework, the case for change has been set out across Scotland and indeed within the North East and Aberdeenshire. We are seeing worsening health. We're seeing individuals spending more years in poor health, and for our most disadvantaged females, that's nearly 2 decades, so significant periods of their life in poor health, and we are seeing increasing inequalities. And again, if we look at life expectancy between the least and most deprived, that can equate to 10 years. Moving forward, the Scottish Burden of Disease has said if we take no action or we don't change, that we will see a 21% increase in the burden of disease over the next 20 years, and 2/3 of that will come from cancers, cardiovascular disease and neurological conditions, which are largely preventable and amenable to earlier intervention. So we know we can make a difference. And the final bit on this slide, first slide, is actually looking at so what determines health, and that recognition of social economic factors, physical environment, health behaviours, and access to quality health and care are the building blocks for health. So it's probably not unsurprising then, but quite a relief for us in the North East because we've adopted the King's Fund 4 pillars approach to population health. That is the model that has been adopted nationally. One of the things that we say is that often when we look at the 4 pillars, we think of them as independent, but actually we know from the work we've done locally is it's the areas of overlap. So what's in the middle, and for us that is really important. And we can demonstrate that through the healthy eating, active living. So often when we look at our response, say to healthy weight, the reaction is, let's give someone a leaflet on what is a healthy diet. But if you're living in our most disadvantaged areas, you would need to spend 50% of your disposable income to afford healthy eating, compared to 11% if you were affluent. And the shops that in your environment are more likely to sell health harming products than those if you were in an affluent. And if you did go to a health professional and ask for some support into access to some of our healthy weight services, currently we've got sufficient capacity to deal with 0.3% of those who would benefit from an intervention. So we're not going to treat our way out of disease. We need to work together. We need to look at the 4 pillars. And that is fundamentally the basis of the framework that is set out. The key that they have, so there's a few questions in there, that the goal is increased happy life expectancy and reducing health inequalities. And again, you'll see from the questions, would having a target be beneficial or not? And if it is, what might we want to look at? And again, members will be conscious that England has set a target of having the difference in healthy life expectancy between regions. So there seems to be a bit of a move in that direction. There's a real, I think, picking up on John's earlier point about how do we strike the right balance. There's so much demand in a system that is so strapped for funding. How do we shift that balance to making sure we can intervene early and prevention? That we need to focus in on individuals but communities. So again, ties very well into the work that's been going in Aberdeenshire in terms of people and places. And that we need to change systems and environments. And again, what I'm thinking about in terms of systems, we often have policies that might come down nationally that aren't supportive to what we do. And taking that learning system approach, recognising that those connects and feeding up the learning might help change the systems within which we work. And of course, working and joining up national and local effort. So we've set out a range of areas for discussion. I think for me, the key question is, we know from the child poverty report earlier, there's lots of really good work going on, but we need to change the pace and scale of what we're doing if we're to tackle the 1 in 5 children living in poverty in Aberdeenshire. And I guess the key question for me is, what do we think need to be different to enable us to do that as a partnership? Our proposal is that at the moment we've got I think until the 4th of October, public's flexible to feedback or comments on the framework. There will then be work over November to take the engagement comments and update the plan. And I understand the plan will be due for publication in December. Why am I optimistic that we will be heard? I think this is the first time where we've had the opportunity to influence what a plan might look like, and certainly across the public health system. And I know local authority colleagues have also been involved in developing some of the evidence base around, and here's some of the areas that we should focus in on. So I'm optimistic that this is a really helpful engagement process, and I will stop there and just happy to hear comments. Chair, we're also conscious that they've got 8 questions, which are really large. So what we're proposing is we'll send something out to members so they can contribute, and if it's agreed, then working through the executive group with Lindsay is collate those, and that will be.
Yes, that would be really helpful, Susan. Thank you. John, do you want to make any comment at this point? Sorry to put you in the spot.
Yeah, no, I'd actually quite like to listen. I've been able to feed in a fair bit of detail elsewhere, but I'm kind of wearing a hat for the CPP here, so I'll listen and then maybe come in at the end.
That's okay, thank you. Okay, folks, so Susan has given us a comprehensive overview of the paper before us, and there'll be a summary of questions will be sent round, and Rob will coordinate through with Lindsay through the executive to get some responses back, and then the other organisations that are listed here will be stakeholders will be consulted as well. Yeah. Okay. Any comments or questions for Susan? Everybody happy that this will come to you and to your organisations, and you'll have the opportunity to respond and contribute in the weeks and months and years ahead. A long-term project. It's not going to be turned around quickly, but we need to do something. Yeah. And the collaboration and collegiate approach would be the best way to do that, Susan. I totally agree. John.
So, yeah, I think sitting here with the CPP hat on, coming from a particular organisation, it's a question for kind of colleagues on this. Is the way it's been described coming across as doing some stuff to sort out health, or is it seen as doing this actually helps all of our work because it's about well-being for the population? It might sound like a complicated question, but I think there's something important about it not being, all the work that's done on poverty or housing or wherever people are coming from, transport or whatever. It's doing it for health. And I just wonder if the population health that implies that, or whether it is seen as a helpful, more all-encompassing thing for everybody as kind of well-being for the population. And maybe people are going to say, "What's he talking about?" But I'd be interested to see what's in your head as you address this. Are you doing it for Susan, or is this something that helps everybody because it's about the population?
Well, it's a national approach, and health and well-being is everybody's business. So I remember years and years ago having a discussion at a local area committee about the definition of health, because people see that as a medical issue. You're quite right. It's a question, isn't it? So it must be a medical thing that's talking about health. But health and well-being is actually everybody's business. So it's RABS in terms of active travel, and it's everybody's business, really. Graham will tell us about the challenges that Police Scotland have. So I'm speaking for you, Graham, but the challenges Police Scotland have in terms of dealing with people that they come across who have got health and well-being concerns. They're not actually crossing that line into criminality, but actually they're unwell. So everybody's coming across it, and I think collectively we all need to kind of park that. Health, it must mean doctors and medicine. It's not. It's a much wider issue. So that's where I'm coming from, if you like. I see that it's a big picture. It's not just about NHS Grampian. It's everybody playing their part in terms of improving people's health and well-being. So I think that's that from my perspective, but happy to hear from others. I don't know, Graham, in your final 4 days, if you really want to put the cat amongst the pigeons in any way, feel free. But I know that a lot of the calls that come to your service, it's well over 70% now, I think, are actually welfare issues. They're not to do with criminality. And quite often you find yourself with people in ED departments and waiting for care. So I don't know if there's anything you want to say maybe from your perspective, Graham?
What I can say just now is it's basically through working with your good selves across the partnership. There's a pilot just started in the city of Royal Cornwall Hospital. We're now getting direct access to the phone navigation centre. So that just started on the 1st of September. So hopefully that's going to make a huge positive difference in terms of the knock-on effect of us waiting at ARI or Royal Cornwall or wherever it may be. Because I commissioned a survey probably in the springtime. And sometimes with 2 officers waiting for about 19 hours, which was ridiculous. It's like over two shifts that were waiting at ARI. So it is a massive challenge, but it's through that collaboration that I'm hopeful that we're getting there. It's like any massive ship, it will take time to turn, but positive steps certainly for the city, and we're looking to upscale that after September if that works.
Thank you for that, Graham. I think they did a pilot in North Lanarkshire, didn't they, as well, in terms of calls going through the call centre and how that was turned around into community solution. So it'd be really interesting to see how the work that is being done with Royal Cornwall at the minute is coming through. But again, that also affects the health and well-being of the police officers, because I am aware that you are changing shifts in ED down in the RI side. So that again, that's not good for anybody. So I think it's that wide piece, isn't it? Right, I'll shut up now. Pam.
Yeah, thanks. So I think I'm not able to drop my, retiring in the same way, but I suppose what in terms of dropping.
Now you can tell us
but I suppose it's more around many years of talking about this agenda, and from the black reports, basically when I was training, so many years we've known this stuff, and I suppose what this does in sense is actually raises this profile and gives the questions to interrogate the decision at government as well, because I think that we know this stuff. I think it's well articulated. I also think it brings it together well. I think this framework, but also I think it not only poses questions to us, but it poses questions to government. And I suppose the thing is that we know, in a sense, we know what we need to do, and I think the approach competition we have, we get more and more evidence base about what we need to do and what make a difference. But I think sometimes we've not had the resource and the levers, etc., to do that. And maybe this is by having this framework set nationally in that condensed form, as when I read it, I thought maybe it does just provide this little lever to keep pushing on this journey.
It's a good aspiration
Yeah,
to have.
We have to be optimistic.
To have to be optimistic, Susan. Yes. Do you want to go back at all? Are you all right?
I think it's just Susan's question was what will be different this time.
Yeah.
And
yeah,
some of us unfortunately have been around this for several iterations where words might be different, but the intent is the same. So I know Susan gets from me all the time, how will it be different? How will it change? That's a key question, which is I found very welcome in the framework, is that that's being posed.
Good. Okay, I don't see any other indications. So the recommendations are there. We've heard the overview. Through Lindsay and Rob, that'll be picked up through the executive. You will get sent a summary of the questions, so please respond timorously, because we don't have a huge amount of time to feedback, and other partners and stakeholders will be contacted in terms of feedback there too. So that's agreed then. Thank you very much indeed. Thank you. I'm just going to crack on and finish the agenda. Item 9, collaboration for health equity in Scotland, CHES, funding bid attached. And again, Pam, I think we're coming to you just for a very brief overview, please, in Jim's absence.
So, yeah, I think again, this is, for approval, so, sorry, I don't have, masses of detail to give beyond what is actually is presented here, but for the group's consideration.
What is it we're asking us to approve?
Is there any specific proposals being put forward, or is the ask if any partners have specific proposals?
So this was, sorry, it's come back to me now, right, so this was discussed at the North East Population Health Alliance, and so I don't think we have submitted one, so there was an invitation to submit a bid against this. The question was, would we do this on a Grampian basis and try and do a coordinated bid? The view is that certainly, I know that City was reported at that meeting that City will be making an application for this. And I think we had previously, I think it'd been shared, Jim had shared it amongst officers, and the view was not necessarily to progress it. So I think Jim's request was to come back to here and to see whether there was an ambition from Aberdeenshire, because there's a view that we won't be doing it as a Grampian wide. City are certainly going on their own and looking at it. I don't think Murray were clear, but we had the conversation whether they were progressing it, Susan, and the question was, well, was there something that we felt would be useful to bid here too? So I think that was, and that is linked to, like, not quote the mark, this is the moment that it's now changed its name. So there was an application form that came in, and it was a sort of exemplar area to work alongside with the expertise of the Collaboration for Health Quality in Scotland team, who are taking forward a kind of MAM approach. So did we want to work and be an exemplar area with them and apply for that? So there was a separate application. So I'm sorry, I'm just noticing that it's not actually included, I don't think. But it has been certainly circulated previously amongst officers.
Okay, thank you, Pam. For those of you who have had any information, does anyone have any comments? All I have is what's in front of us here, so I can't offer a steer in any way, so I don't know. Susan, can we come to you? Maybe if you got anything you want to suggest or not?
Yeah, so I mean, previous came out looking at the work that Mark has done in England, which was most of the evidence that we looked at. They had the outcome was that they had reduced the decline in health outcomes. Public Health Scotland commissioned this piece of work with 3 areas. So I think, to be honest, it's up to each area to decide. But what I would say is, if you decide not to apply, and I know many areas are deciding not to apply, that there will still be a learning network that will come from that. And I would hope that if any one area in the North East was successful, then we'd be able to share early learning across the partnership. So I think, given that it's the 18th and the applications need to be in by the 23rd, I guess we're being asked to support not applying. But I would ask that we do make use of the opportunity to learn from the successful areas when information becomes available.
I think it's not clear from the report that's been submitted what it is we're being asked to do. So I would suggest that, on the basis that no one is putting their hand up to suggest an area of work that could be supported by this, then I mean I'm just not clear what is being asked of us here.
So what did the executive group make of it?
I don't think this has been through executive group. So
This
this
is like,
is
that's
I think
Yeah.
people are missing a bit.
first time I've
No,
seen it.
yeah,
I think
you should. Don't think we've seen it.
From my perspective, and certainly in discussion with other officers, there's already so many things going on in terms of resourcing something around this. We'd be really keen to see the learning coming through, but in terms of an application, we wouldn't necessarily be keen to do that.
I think that was a position, and then when there was discussion today, just to double check, because other parts of the North East are doing it. So do we want to join or do we want to learn? And I think what we're saying probably we want to just learn from others.
I think that's the steer that's coming from the room. To those of you on the call, the steer in the room is that perhaps we would benefit from the learning and want to follow the outcomes and to follow that through. And I guess would that be through the Alliance or this board, or who's going to pick that learning up?
So I think, and to be honest, I don't know any more about this process than what is in the piece of paper. So this is
Sorry, we're not picking on you.
an national programme.
Looking to you for guidance.
But my understanding from Public Health Scotland is they will have their equivalent of learning events, and I would anticipate that we will be invited to that, and we could decide how best to be represented.
Okay, that's a good advice, good guidance, and I think that's the position I would recommend that the board take at this point. Clearly, if this comes back, then we might be in a better position to be able to, if there's another round, or if it comes back again, or certainly the advice I think is that we seek to learn from the process and that we don't apply at this point. Is that agreed? Great. Okay, thank you very much. And finally, we've got the police workshop. Again, there's a report attached. So really just I think I'll go straight probably, Fiona, to the recommendations. Consider and comment on the outputs. Note that the governance arrangements around agreement and reporting of police plans detailed in the report will be set out in a draft governance framework, which will then come back to the board in due course. Agree area managers within the council areas regularly report to the CPP board and executive around the development and implementation of police plans, and consider, comment on and agree the review of the LOIP priorities, and agree the transition arrangements as detailed in the report in item 10, starting on page 215. Are there any salient points, Fiona, that you want to pull out without going through too much of what's in the report?
Thank you, Chair. No, really just to be really interested to get the views from partners around the table about the contents of the report. We had a really good workshop at the CPP exec last month. There was really good contributions from all partners around how we might deliver place and the review of the LOIP priorities. Everything's set out in the report, so I'm not going to rehearse everything here, but I'm really keen to get views from partners on the outputs from the workshop and recommendations.
Thank you very much. So I'm asking for those views, please. If there are any, Dr. Thomas and John, thank you.
Okay, save me scrapping around to get my hand up. Yeah, at 3:10, the discussion was looked at. Key part of successful delivering police plans is that partners openly and transparently communicate their priorities and strategies. That this, I presume it's this CPP board. Okay. So just as I read that, I was just thinking, what hasn't been happening and what will happen if putting that in place?
Thank you for your Chair. So it was really just so that I think one of the points that had come out from the workshop was around resourcing and partners at the local community planning groups who were perhaps feeling unable to commit to the priorities that were identified in police plans, and it was to try and get those issues resolved at an early stage where there were going to be any resourcing issues around different priorities of different partner organisations.
Okay, so I suppose what I've got in mind is we're coming at this from the Health and Social Care Partnership, Pam and from the IJB myself, is that we would have something which explicitly says what our approach is in relation to place, and anything that we are doing that develops that, and then that helps people on the ground in the areas see that as a key thing for them. Is that, or am I not picking up?
Can I ask Amanda, as an area manager, with you've got a different hat on there, Amanda, as an area manager, what would your expectation be of your local community planning partnerships as you develop your place strategy or place plans, rather?
I mean, our local community planning partnerships are really going to be key to what we do. The challenge is how we make them work across that place piece without necessarily dismantling partnerships and arrangements that work well. But certainly I see the local community planning groups alongside the council's place team almost coming together and perhaps being that place team for the community. It's something that the area managers are all having quite a debate about as to how we make it work without putting too much additional demand on partners or officers, and trying to recognise that there will still be elements of similarities across places that mean having a single kind of group team looking at things from a strategic perspective is helpful.
For example, in Amanda, you've got in your area location managers from health and social care. Those would be your links into your area plan, into your place plan.
Yes.
Okay, yeah, and then that joins it up. So as a partner here and working with Pam, then the expectation from the IJB is that we're supporting that at the local level, and that's what you mean with that direct, so that there's an expectation that that will happen.
Because location managers report into area committees, for example, so the area management team and the local community planning group is around that as well. So location managers for health and social care, for example, are at the table anyway, or should be.
Well, that's fine, and that's a bit of the mechanics, but I do agree it's a key point, because quite often avoiding people getting stuck in their silos, and what I've seen is people come readily to those kind of conversations, but then they go back to the ranch and it just gets disappeared. So this is a way of trying to get traction on that. Yeah, okay, that's good.
Okay, thank you, Pam. If you don't mind, can I take Susan in? She was waiting yet.
Yeah, no, thanks. And it's a really exciting opportunity. I guess for me, the local areas are different, and how things come together will be different. And if there are services that are planned at that slightly, whether it's local authority or indeed, Grampian level, then we're going to take a bit of learning as to how we make those connects and make them well. And I didn't get the sense from the paper about how we capture learning, because there's something about challenges, there's something about outcomes, but actually the process of doing this in 17 areas and capturing the learning hugely important somewhere big like Aberdeen Royal Infirmary, where we're going to have to work away out, community appointment days are one example, but there'll be lots of things, I think, I'm hoping lots of things need to change. So it's just how it didn't leap off the page. It felt quite traditional evaluation, as opposed to there is a blueprint. We're just going to test it, learn, and then try and change the system in response to that.
Yeah, no, happy to take that on board. I really like that, and I think that's probably something that we can take through the executive and channel through there. So yeah, really happy to take that on board.
Thank you, Susan. Pam.
Thanks. Yeah, so it's just to confirm that So we, as you know, John, we've taken through the IJB that we will, instead of doing locality planning in future, will be part of place-based planning. So that's kind of one area of linkage, but we are, you know, like any other service, we operate within a place. And by working with partners, and it goes back to, for example, issues like social prescribing, for example, that's where we'll make a difference. We had a conversation about transport earlier. That's what we have, you know, for our services operating in places. There'll be some solutions that we will be able to engineer better by working on that place-based plan locally. So that's us as a service and playing into place as an agenda. But you know, we've also got an idea of how we might reform our services to operate in places, and that's when we will need to also then lean into place-based planning, because we might change how we deliver things, which has an impact on place. And therefore, by as articulated, working with the area managers, working with other the leads, third sector, community councils, etc. in that area, we can then change and innovate and move forward, because we're actually doing that, making that linkages. So I think it's, you know, to me, there's good alignment here. I think we, you know, but I do agree with Susan in terms of something we just have to try and then see, you know, how it works and maybe iterate as well.
Okay, Fiona. Yeah, I don't see, we've talked a lot about health, but clearly, you know, when we're looking at SDS, for example, Nicola, then there'll be an opportunity for all of that to be fed in as well. So actually, it'd be good for everybody. The voluntary sector, Dan, you know, everybody's going to have a stake in it. So I suppose the plea is that everybody plays their part and helps to feed into the area manager's work and bring those local place plans forward at the appropriate time. Be 17 done over 3 years. So some of that learning will absolutely transfer, Susan, and I'm sure the area managers will all be working quite closely together. And it's, you know, different experiences, but certainly Anne Overton, the Geary area manager, has done some of this already. Amanda has done some in Peterhead. So, you know, they will have learned and be able to share their experiences there too. Okay, so can we then look, agree the recommendations as written then, please? And Fiona has captured the conversation and been taking that forward. And that's agreed. Okay, thank you very much indeed. That concludes the business for today. Can I just thank you all very much indeed for your contributions and your attendance. The next time we meet will be the 4th of December at 2 o'clock here in Retail House in room 5. And there will be an online option for those of you who are not able to come into the room. So I hope that it's been of the agenda's been of interest to everyone. Thank you all very much indeed for your support and your participation, and look forward to seeing you in due course. And again, best wishes, Graham, for your retirement, and thank you again for all the work that you've done within Aberdeenshire, within the North East, in the years that you've served here. So thank you and best wishes.
Thanks again, and I'll probably see you tonight till Melbourne.
And you're coming along. Oh gosh, I think half the board's going to be there. But anyway, thank you very much, and we'll see you later. Thanks everyone. Thank you.
Thank you. Bye.
Thank you.
Thank you, everybody. Get your blood drags on.